Hello all, this is Dr. Dheeraj Masapu, and in this video what I am going to talk is how can you actually earn 20 lakhs plus per month, in the rupees, as a doctor in India. See, most of the doctors are earning a fraction of it, around 1 to 3 lakhs in between is the average salary of doctors, even after 10 plus years of experience in India. Okay, most of us might be knowing that. So then how are some people earning 20 plus lakhs and how are some people earning 2 crores also per month? Okay, even though there are only few people in India, but there are some people who are earning crores of rupees per month. So how is that possible, and what is the actual strategy for doing that? That is the whole concept behind this video. Okay, if some other professional is watching the video, please understand that there are only few people who is actually earning this kind of salary as a doctor, and in other fields also like engineers, lawyers. The top people are earning crores per month. Okay, let us not get distracted. Let me focus on the strategy to reach this particular position. The strategy which I am going to tell you today is called as a 1000 transformation strategy. What is this 1000 transformation? I'll tell you. See, as a doctor, if you're a clinician, okay, you might be a physician or a surgeon, or you might be some dermatologist or whatever specialty you belong to. What I am telling is, your job is not to treat the patient, your job is to transform the lives of the patient. Let me explain in a more practical way. For example, if a patient is coming to you, you're a surgeon and a patient is coming to you, for example, with some kind of seizure or a tremor or some pancreatic problem or stomach problem or something. Okay, then your job is not to actually do some procedure which you know on him. Okay, your job is to actually do the best for him and transform his life. Okay, let me explain you. So for example, to treat this particular patient, okay, there is one device or one procedure or something, okay, which is available in Israel, and Israeli doctors have mastered that. Example I'm telling. What I recommend is, you have to actually sacrifice your practice. You have to actually take leave, maybe for a week or 10 days. You should somehow go to that place, learn the technology, learn how to do that. Since you're already an expert, I hope you're an expert who's watching this video, and you have to go to that location, learn that skill and come back, and then do it in affordable price on this particular patient, not sending this patient there. In the process, what happens is, this particular person's disease will decrease, and then not only that particular disease, you would be having other problems also, like diabetes, hypertension, obesity, and all lifestyle problems. So even those aspects also, you will get actively involved and you will transform his life from point A to point B. So that is called transformation. Treatment is different. Treatment is like, you will just tell that this problem requires this. I know this one, I will do that. Or you refer to somebody who can do that. So that is just treating a patient. Even if you treat a lakh patients like that, you cannot dominate the industry. That transformation technique, what I'm talking today, is going to make you dominate the sector. Okay. So basically, that one person, along with him, you will also travel with him. If required, you will develop a WhatsApp group with him, and then what happens is, you will involve the relevant experts like nutrition specialists and weight training specialists, everyone along with that particular person in the group, and like that you will get him to point A to point B. If required, you learn the skills which are required to treat him. In the process of learning the new skills, you will actually go through a lot of uncomfortableness, because any skill, okay, which is a new thing, will be very difficult for a person to learn. So you'll go through an uncomfortable journey in the process. So if you want to do great work, that will only come when you go through a very hardship and uncomfortable process. If you're going through that, just be happy, because you're going in the right direction. Your strategy is absolutely right. Okay, and then you will learn the desired skills, and you'll do it in affordable price to patients in countries like India and other developing countries. So then what happens is, okay, this person who's transformed from point A to point B, and what if you do like that for 1000 patients? That's all you have to do. After that, you don't have to break your head. I'll tell you why. Because these 1000 people who got their lives transformed, okay, will take care of the rest. Rest is history. I'm telling you, you will be a legend. These 1000 people are going to tell 10,000 people, and those 10,000 people are going to tell 1 lakh people, and there will be people waiting outside your OPD to just get their lives transformed. And then you will pick and choose. Okay, because you cannot transform everyone's life in India, right? You might form a bigger team, you might form an enterprise if required, and based on the need. It's not about setting up a hospital. Okay, it's all about once you have the demand, then you hire people according to it. It can be done through like software enterprise AI based also, and then you will try to scale it to the next level and transform lives of more people. This is the basic concept. So how many years it would take, Dheeraj? It is not the time frame. It is the mindset shift that you need to undergo. Okay, and when you're in the process of transforming patients' lives, sometimes you will fail. Some people wouldn't understand. Some people might curse you, saying that you have actually got me through all these things, but I didn't get the result. You should be ready to face all those things, because when you're actually transforming 1,000 people, 100 or 150 times, you would fail. Okay, but the thing is, your intention to treat them is right. Okay, that is the main point here. But sometimes you will fail, but 850 people lives you have transformed, they will have a lot of gratitude towards you, and that is enough for us. So it is not that 100% success you are going to get. Okay, let me come back to the point. So as more practically I'll try to explain. So in the process of transforming, if you're a surgeon, you might go to other countries and learn skills. You have to take leave, you have to stop your practice, and you have to go there and learn the skill and get the equipment, contacts of the equipment, and get those equipments, and then you have to operate in this particular place. So you shouldn't always see how much you're earning. You should only count about how many lives are transformed in your lifetime. Okay, so that is the metric on which you have to assess yourself, and don't compare your success with other people, because you are in for a long game, and others are actually seeing a monthly salary. So people with this mindset who want to continuously upgrade their personal and technical skills in transforming others' journeys. So then some people are asking me in a mentoring program, so what are the skills you have to develop? See, I don't know what skills you have to develop. The skills you have to develop will largely be dependent upon whom you are transforming. If you're a high transplant surgeon and you're transforming somebody's bald head to more natural looking hair, okay, you might have to actually go and learn a skill in some other country like France or Italy, somewhere, who has a skill to actually make it look like more natural. For that, you might have to again take leave for maybe 3 weeks, 4 weeks, go there, learn that skill, and come back and then practice again. And then if you are a brain surgeon and some Israeli doctor knows some kind of technology where he plants something in the brain and then hands start working, and then you have to go there, work with him for 2-3 months. You have to sacrifice the practice here and family, go there, learn that, and come back. So it largely depends upon your patient's requirement, and your intention is to actually treat the patient. Once you come back with the technology, you will call the same patient and tell that for only you, I went there, I learned this, I will do that, I will take the risk. You will take the risk and take the consent, take video consent, explain to the patient family that only for you, they will understand, because you went there, learned that. If required, the surgeons from there also would come and help you for initial cases, and that is usually there. It is because in medical field, what happens is, I went to Africa recently to help people in teaching some kind of anesthesia skills. I don't charge anything for that. I spent all my money and went there. So it is more like we help each other. So that nature is always there among doctors. So they will come and help you in the initial phase. So in that way, you can transform life of one person. So each person is very important for you. You transform life of that one person, and then okay, only 999 left. Once you touch 1,000, after that you don't have to see back. You dominate the sector. I will write and give you, will dominate the industry. And people will be standing in queue outside your OPD or hospital, whatever it is, and you will pick and choose whom you are going to treat, because your intention is to transform. You are not going to deal lakhs of patients. You are only going to deal few patients in a week. On those few patients, lives will be transformed. And if you don't have the skill, you'll go and learn and come. And then you will form a WhatsApp group with them, and then you'll follow them up for a long time, and then you might actually become God in their lives. So this is how you actually go to point where you earn 20 lakhs, 30 lakhs, 40 lakhs and all that. Not by working in a sector, not by doing something which is trendy, not by actually working in one hospital for more than 20 years and getting some positions. And some people think that if I get, Dheeraj, if I become senior consultant like you, I can make more salary. It is not like that. I have learned neuromonitoring when other anesthetists and other people didn't know in 2015. And then I have learned so many new things. I took risk in so many cases to transform lives of the people in anesthesia, so that they get benefited. So by doing all these things, that is a metric on which I assess myself, not by the position I get. I might be an associate consultant also, doesn't matter for me. Only thing what I would see is whether I am actually transforming that person's life or not. Within anesthesia, I can only do this much. Okay, if I am a surgeon or if you are a physician, if you are somebody else, you have even more responsibility to do it. Okay, it is going to be hard, but remember that greatest things will happen only when you are going through uncomfortable situations. If you are comfortable that day, that means you have not done anything great. Okay, remember this. And nothing will come with time. Okay, things will come only when you utilize the time properly. Please understand this. So this is a strategy that you need to understand. I told, I think, very clearly about what you should do for the next 10 to 20 years. Okay, if this video, if you have watched, then I think you are going to transform your life. And as usual, Dr. Dheeraj Masappu logging away. One more thing is there. If you want to sit with me and talk to me for 15 to 20 minutes, that is all I can, give for you, because I really want to transform your life. That is why I'm doing this video. So there is a link for mentoring. You can actually talk to me for some time. I can explain you better, understanding your situation, because everybody's strategy should be different according to me. It can't be the same strategy everyone should follow. It's largely dependent upon the target population that you're catering to. Okay, so like if you're an anesthetist, your strategy should be different. If you're a radiologist or intervention radiologist, it should be different. If you are a eye transplant surgeon, it should be different. Okay, so wonders can be done. These rules will apply immaterial of which country you are in. Any country wants such kind of people only, and no country wants a person who cannot, who doesn't have the skill to deal or address the problems of the patient. So try addressing the problems. The bigger the problems you address, the bigger you become. Otherwise, you take a fraction of what the big people make, and then enjoy with that. Okay. Thank you very much. Thank you for following the video. Thank you guys. Thank you very much.